I'm Dr. Gerald Simmons, and I'm going to demonstrate to you the chin press and the chin press tongue curl maneuver. We've come to find that this is one of the more predictive parts of the physical exam to identify those patients that may actually have obstructive breathing during sleep. All the other components are important, but this sort of tries to simulate what occurs during the sleeping process. So this is a way of going through the part of the examination. We start off with our baseline, and you have the patient lying supine, maintaining a gentle bite. So the instructions I give the patient are like this. I want you to bite down, and I want you to breathe in and breathe out through your nose. Breathe in and breathe out. Okay, do that again. Breathe in and breathe out. This is the baseline condition that we're going to compare when we go do the chin press and the chin press tongue curl. But at this part of the examination, in some patients, we actually can observe alar collapse, and that's when the ala of the nose pulls inward from the negative pressure that's created from the flow of air through the nose. And we don't see it in this particular scenario, but that can occur and is a sign of nasal obstruction. Okay. So now, I want you to relax your jaw, I want you to relax your tongue, and I want you to relax the muscles in the back of your throat. I'm going to gently push down on your chin, and I want you again to breathe in and out through your nose. While you're doing that, you may feel a blockage develop in the back of your throat. If you feel that, I do not want you to try to prevent that. I do not want you to thrust your jaw or your tongue forward, because we're trying to see if your airway is going to be blocking as your jaw falls back and your throat is relaxed, okay? So just open your mouth just a little bit, relax your jaw, relax your tongue, and breathe through your nose. You actually blocked at that point of expiration. So it's both an inspiratory then expiratory. Now if someone blocks during this, if there's a partial blockage, we call that a 1+ on the when we grade this. She actually had a 2+ because she came to a point where she had a complete blockage. We'll do this one more time. Just relax your jaw, relax your tongue, and breathe through your nose. Okay, so you can see that her blockage occurred right at the very beginning of the expiratory process, at the very end of inspiration, end of expiration. Okay, so that's the chin press. And again, that can be scored at 0, 1, or 2. 1 would be partial blockage. So you'd maybe hear snoring, or you hear some, you could hear that there's some obstruction. Or sometimes you can't even hear it, but the patient describes that they had noticed it was harder for them to breathe. Okay, so now again, comparing it to when you bite down, there's no blockage. Okay, so now we're going to do the chin press tongue curl. I want you to relax your jaw. Now I want you to put the tip of your tongue on the roof of your mouth and move the tongue to the back of the roof of your mouth. Okay, now I want you to breathe in and out through your nose. Okay, so here now she's actually having complete obstruction on inspiration too. So this is a real profound degree. So there's a 2+ on the chin press and a 2+ on the chin press tongue curl. Now bite down and breathe through your nose. And normal. This is a great example how mandibular position can change the airway. Now obviously, our patient here does not have obesity. She doesn't have a thick neck. She doesn't have some of the features that people think sleep apnea is always associated with. This is a patient that has mandibular anatomy and soft tissue intraoral anatomy that predisposes her to obstruction, and when her jaw is relaxed, when she's asleep, her airway blocks. And you could see that bruxing or clenching or keeping the mouth closed drastically improves the airway. Thank you.